Aloha, guys. Dr. Thomas back. We're going to finish up our fascinating discussion about vision, and we're also going to talk about hearing. Okay, I think we covered all these, so we're going to the next one. All right. This is a test for visual acuity. You've all seen these in the doctor's offices. You don't want to squinch up one eye because that affects your vision. So you cover it with something. This is called the Snellen eye chart with an S, named after, I guess, Dr. Snellen. You test each eye for visual acuity. Treatment, let's see, enucleation, removal of entire eyeball. Yeah. I would think, guys, in cases of extreme trauma or cancer or something like that. Laser photocoagulation, argon laser creates inflammatory reaction, seals retinal tears, and leaky blood vessels. It's like my brother went through with diabetic retinopathy. LASIX. Okay, they sculpt the cornea. That's how much, guys, how much role the cornea plays in focusing light. When they do this LASIK surgery, it's really amazing. I don't know much about it, but they evaluate the shape and all of the cornea, and they make little cuts in it to change the spheroid characteristics of it to focus the light so you can stop wearing eyeglasses or contacts. Keratoplasty, surgical repair of the cornea. Okay. Scleral buckle, I thought we mentioned this a moment ago. Suture of silicone band to sclera over detached portion of retina. It's another treatment, and no, we haven't talked about this. Okay, people with cataracts, guys, are real common in older people. It's quite common, and I don't know much about it either, but I know they can go through the pupil, and they zap it with ultrasound, and it breaks up the cataract, and then they suck it out of there, aspiration, and then they implant a plastic lens in there, and it's good. They do one eye at a time. I've known a couple of guys had to have it done, and they do one eye at a time because you got to wear a patch over it for a few days. But it's absolutely amazing how good they are with this kind of stuff. I'm often, guys, as you probably know by now, I'm often critical of the medical profession and feel like it's deserved, but the things they can do with ophthalmology really amazes me. Vitrectomy, remove the vitreous and place it with a clear solution. Now, they also did this to my brother. Because remember, the vitreous humor in the posterior chamber is a thick jelly-like material. And in order to keep new blood vessels from forming, which they don't want because they're going to start leaking, they take that out and they draw it out. My brother said they replaced it with saline, salt water solution. And that doesn't give the support, and so it hampers the development of neovascularization, new blood vessels. Diabetes mellitus, guys, is a systemic disease that affects the basement membranes of connective tissues and things. And for that reason, it affects blood vessels. And the little tiny arteries, arterioles in the eye start leaking. And it's like you covered over, let's say you took red paint and painted over your computer screen. You couldn't see through it. Well, it's sort of like that. So this is one of the things they do also. Okay, now, some of these abbreviations, guys, are going to be things that you don't know. I don't know if I didn't see them used in context because they're specific to the field of ophthalmology, okay? However, you're going to have to take a test. So here's that argon laser trabeculoplasty, age-related macular degeneration. This is quite common. I wouldn't have known that. This, I do know. This is, during physical exam, is often commented on. Head, ears, eyes, nose, and throat. IOL, intraocular lens. IOP, intraocular pressure, like what can cause glaucoma. LASIX, that's it. The money making, but good, I guess. The people I've met that's had it done said they would have it done again. In situ means they're doing it right there in place. Now these are important. OD means right eye. OS means left eye. OU means both eyes. I know what you're thinking. You say, Dr. Tom, why don't they use abbreviation, the letters that are actually on the word? Why? Because they're used in Latin, that's why. Let me say this. The ancients thought that left-handed people were evil or sinister. And even the early Christian church thought so too, and probably some still to this day. Okay, so anything left has an S in it for sinister. I am not making this up. This is actually where it comes from. There's another example, I can't think of it. So know these three. This is another important one too. Perla. It means pupils are equal. They're the same size. They're both round. They both react to light together, and they both react to accommodation. The pin. So in other words, guys, if the pupils are dilated and you shine a light in one of them, both of them should go and constrict. If only one of them does, that ain't good. Something's wrong. That's what that means. Primary open-angle glaucoma. Yeah, I would never know that, though. Photoreflective keratectomy. Yeah. Selective laser trabeculoplasty. Visual activity, visual field. You might see these a little bit. Okay, let's see what we got here. Absence of the lens is a fact here when cataract is extracted. Okay, yeah. I wouldn't have known that. Blepharitis, this is inflammation of the eyelids. I would know this. Blepharitis, of course, we know what itis means. Cataracts, clouding of the lenses, changes in the denaturing of the proteins of the lens. Lacrimal has something to do with tears or tear glands. Ocular, something to do with the eye. Ophthalmoscope, it's the device the doctor looks in your eye with. Takes a lot of skill, guys, to use one of those, but it's really wild. The eyeball is the only place in the body that you can look in with this instrument and see the blood vessels and nerves in their natural state without making an incision to see it. Photophobia, a fear of pain-inducing exposure to light. Conjunctivitis, inflammation, infection of the conjunctiva, the lining. Your kids get that a lot. Pink eye and infectious conjunctivitis. Errors of refraction. Hyperopia, myopia, all that stuff. Keratitis, inflammation of the cornea. The cornea, guys, is extremely sensitive. And if you get a little scratch or something there, it can be really, really painful. Way out of what you would think. Retinopathy means disease of the retina. Opathy means disease. Retina means retina. Permanent damage to the retina. Strabismus is the medical word for being cross-eyed. Uveitis, inflammation of the uvea. Okay. Okay, well, we finished with the eyeball. Okay. Any questions? Anybody out there? Then we'll move to the ear. The ear is quite a bit simpler, guys. It's still very important. Okay. There's three parts of the ear. There's the external ear, the middle ear, and the inner ear. See the borders here? The blue, the middle. So the external, the ear that we see, boing, boing, is called the auricle or the pinna. Then there's the hole here is called the external auditory meatus. And there's a canal that goes down to the eardrum. Here's the eardrum. The eardrum separates the external ear from the middle ear. The real name for the eardrum is the tympanic membrane. Here it is. Now, attaching to the tympanic membrane are three tiny little bones called ossicles. They're the smallest bones in the body. And they are the malleus, the incus, and the stapes. Here's the word, malleus, incus, and stapes. As air movements come in here, they cause the eardrum to vibrate. That moves these little ossicles. The incus, the stapes, articulates with something called the oval window. And it passes those vibrations on into this device, or structure, I should say. And it's called the cochlea. The part that's shaped like a snail shell is called the cochlea. And these up here are called semicircular canals. The semicircular canals control balance. The cochlea determines hearing. And it hears auditory nerve fibers, or vestibulocochlear cranial nerve 8. Here's the vestibular apparatus, and here's the ones from the cochlea for hearing. Okay, let's see. So, external ear, middle ear, and then the cutoff between the middle and inner ear is the oval window here. We also have a tube called the eustachian tube on either ear that connects the middle ear with the throat. And it's what equalizes pressure. Guys, like when you're flying an airplane or something, you're coming down and your ears start popping, that kind of thing. It's where it makes that sound. It's air flowing through this eustachian tube to equalize this pressure. If your ears are stopped up badly from sinus or a disease or cold or something, it can really hurt to fly because all that mucus in there's got it clogged up and it can't equalize. It has trouble. Okay, so that basically, guys, this is a cross section, of course, of the ear. Let's see. Yeah. So the vestibule and semicircular canals deals with balance and equilibrium, and the cochlea with hearing. I don't want to have to do a third one. Let's see if we can move along. Acousto means hearing, audio means hearing, audito means hearing, or auricular means ear, cochleal means cochlea. Mastoido, a mastoid process, these bony bumps right here that you feel near the ear. Moringo is the eardrum or tympanic membrane. Ossicula, the ossicles, are those three little tiny bones. Oto means ear. Here's the root word. Oto means ear. Salpingo is eustachian tube or auditory term. Yeah, okay. Stapito, stapes, one of the ossicles. Tympano, this is the more common. Sorry, guys. This is the more common word for the eardrum. Vestibulo, vestibule, part of that by the semicircular canals. Acusis or acousis is hearing. Meter, the instrument to measure. Odia is the ear condition. Auditory canal, the canal that goes down. Auditory meatus is the outer hole here. Auditory nerve fibers carries cranial nerve 8. The brain, center for hearing, is in the temporal lobes right here. Auditory tube is the eustachian tube we talked about. I don't know why they put that. I mean, I've always heard it called eustachian tube. Auricle is this part of the ear. Cerumen is the word for earwax. Modified sweat gland. Cochlea, snail shell-shaped spirally wound tube in the inner ear. Endolymph is the fluid within that labyrinth and cochlea in it. The vibration sets that into motion, and there's little hair cells that detect that. And then they send that, the cranial nerve 8, to the temporal lobes, and it's detected as sound. Eustachian tubes, we know what those are. Incus, one of the ossicles. Labyrinth, a maze-like series of canals in the inner ear. Malleus, one of the ossicles. Organ of Corti, sensitive auditory receptor found in the cochlea of the inner ear. It's what does the actual hearing, guys. Ossicles, small bones, oval window. Remember, the stapes articulates up there with it. Perilymph fluid contained in the labyrinth of the inner ear. Set in motion, sets the hair cells in motion, and that's what we hear. Pinna, the outer ear, semicircular passages, we see 3 of them. Stapes, third ossicle, tympanic membrane, word for the eardrum. Pathology. Acoustic neuroma, benign tumor, arising from 8th cranial nerve, causes tinnitus, ringing in the ears, vertigo, dizziness, cholesteatoma, skin cells, cholesterol sac in the middle ear, deafness, loss of ability to hear. Meniere's disease, disorder of the labyrinth with elevated endolymph pressure in the cochlea, semicircular canals causing tinnitus, sensitivity to sound, progressive hearing loss, headache, nausea, vertigo. I've treated some of this, and sometimes they get really bad headaches from it. Yes. Otitis media, inflammation of the middle ear. You can often see it through the membrane. You can look in the ear with an otoscope, and you can see the fluid level through the eardrum. Autosclerosis, hardening of those little bones, and they stick together, causes deafness. Tinnitus, ringing in the ears. Vertigo, sensation of whirling around the room, like when you got drunk after high school. after middle school, probably. No, I didn't say that. Clinical procedures. Audiometry is measuring hearing. Cochlear implant, surgical implanted device that allows sensor neural hearing. I'm not going to be able to finish. Ear thermometer. You can take the body temperature through the ear. You can look at it in the ear with an otoscope. You can use a tuning fork to test it. Yeah, I'm going to get everything, guys, but these 2 pages of, the ear. Left ear is also AS. Left eye is OS. Left ear is AS. Same reason. S is sinister. They're sinister. Oh, they're evil. Oh, the devil's got them. ENT, ear, nose, and throat. All right, guys, we're going to finish up, read over this stuff. We went over most of it. We'll see you next time.